So a few months back, I had a spinal fusion surgery. I had the ALIF, the anterior lumbar interbody fusion. And of course, prior to, having the surgery, I did my research. I, Googled and YouTubed. I watched several of the operations itself, and I followed folks and watched their stories. I wanted to see their journeys from, prepping for the procedure, post-procedure, through that whole recovery process. And I have to say, out of the many videos I watched, there was probably only one that was not all that positive, right? So with that information in hand, I went ahead and had the surgery. But prior to having the surgery and speaking with my surgeon, he explained the process to me. He let me know that, we're going to go in from the front, we're going to shift all of your organs to the side, and I'll be working with a vascular surgeon who's going to be doing that part for me. And then we're going to access the spinal column and go in and put the spacer in the screws. You'll stay in the hospital overnight. We'll have physical and occupational therapy come in, clear you. You'll go home. You'll start walking immediately. Like, we're talking like hours after the surgery. They want me up, moving around, walking, getting ready to prepare myself to go home and function. And so I'm like, okay, cool. The day of the surgery comes, my husband takes me, they prep me, put me under, of course, I'm out like a light. I feel myself waking up and I have to go to the bathroom real bad, gotta pee, right? So the nurse says, well, good, because this will be our first opportunity to try to get you up and moving. So they bring a walker to the side of the bed and, shift my legs down first to be able to get a hold of that walker, and that was not happening. When my foot hit the floor, my left leg, all of my issues with my back were related to the left side. I had, still have sciatica really, really bad. I have a history of back problems. I had a previous microdiscectomy about 10 years ago, was rear-ended, had a fall at work on the anniversary of my microdiscectomy. And then I'm older, age, degeneration, arthritis, all those things were going on at the same time. And anyway, back to the story. I go to get up, I can't move my neck. I'm like this, right? I have this headache that feels like my head is about to explode, and I'm like, oh crap. Crap isn't really what I said, but oh crap, they've paralyzed me, And so what was supposed to have been a one night at the hospital turned into 5 days at the hospital, because it was days before I could walk without excruciating pain. It was days before I could move my neck. It was days before they got those headaches under control. So yeah, it was not that typical, oh, this is just a routine procedure, this is how it's going to work type situation. And here I am now, some 8 months post-surgery, and I'm actually feeling worse than I felt prior to the surgery. So before I saw the neurosurgeon that performed my surgery, I had gone out to Walter Reed and saw a neurosurgeon, and she told me then, based on the MRI that she was looking at, that my sciatic nerve was being sandwiched between the scar tissue from my microdiscectomy 10 years ago and the spinal issues that I'm currently having. So they're sandwiching my spine, which is what's causing all of the numbness and the tingling and the tightness and the pain. Well, with this procedure, with the ALIF, sometimes they can do the ALIF and go in and put that titanium spacer in the screws, but they will also go in from the back and clean up any issues that are going on from the back. My surgeon says that, no, we shouldn't have to go in from the back. Everything should be fine. We should be able to take care of all the issues, open that space up for your nerve to have room to move, so there's no longer any compression, so you should be fine. My most recent visit with my surgeon, I had to actually ask for an MRI. They did the x-ray. I guess he wanted to make sure the work that he'd done, that apparatus that's in there now is in place and doing what it's supposed to do. But I explained to him, I said, that may be the case. You did an awesome job putting that in. However, I am still experiencing pain. So something is still not right, right? So then he sends me for another MRI. After the MRI, I go see him and he says, well, there is still some compression from the back. Now, mind you, I told him that the neurosurgeon I saw before him said that whole sandwiching thing. I've got this scar tissue from this 10-year-old scar that's also pressing on the nerve. I guess he assumed that, if we clear up from the front, it's going to make enough room to where that scar tissue is not going to be an issue. Well, it appears that scar tissue is still an issue. So now we can go back in and clean that scar tissue up. Well, I'm really not feeling like I want him to go back in and clean anything up. So my primary recently sent me for pain management, right? I had been going to physical therapy, and physical therapy released me. They discharged me because I was still in pain, and the exercises and things that they had me doing was just exacerbating those pains I was having. So they were like, no, get your pain under control, and then we can revisit physical therapy. So then like I said, they sent me now to pain management. I have apprehension to pain management because I've watched several documentaries on these pain management clinics that are just pill mills. They just want to dole you out opioids, and people have getting hooked on them and dying, and I don't do drugs well. I still have some of the drugs that I had from my surgery. I just don't take them. They don't alleviate the pain. Most recently, my primary prescribed me some Tramadol and some Flexeril. The easy way to say it, so Flexeril. And yeah, the first time I take them, they do help me sleep. So I did take them that first night. I got that kind of foggy feeling. It never does anything for the pain, but it gives me that foggy feeling, and the next day I sleep like a baby. I don't sleep the same day. It's really weird. I don't know if it's my composition or what, but anyway, so I don't take them. I mean, I'm not going to just be groggy for no reason and then there's no pain being alleviated. So I go to this pain management appointment, and first off, I'm not really confident when I walk in because it wasn't all that clean, and then the staff didn't appear to be all that organized. It was like they were just running around. And when I go back into the room, the doctor comes in and he's going through what he has of my record. And I have to, of course, fill in some gaps. And then, of course, the first thing he says is, well, we can try a few things. And I notice when I walk in, there's this apparatus, this flyer, this poster kind of thing on the wall for this gadget that they can implant into you, and it sends these ever so often, shoots this medication to the pain area, right? I'm reading this as I'm waiting for him. And when he comes in, he talks about, options. We can start out with, medications. We can, put you on some gabapentin. Are you taking any medications for depression? And I'm like, well, no, I'm not depressed. And of course, y'all know these medications can be for multiple things, right? So I'm already in the back of my mind, I'm like, okay, pill mills, y'all just want to drug me up. So I'm listening. So we can start you out with gabapentin at the slowest dose, 300 milligrams. You start out taking that. If that doesn't work and you don't experience any of the many side effects, We can up it. You know, the dosage can go up as high as 1,600 milligrams. We're going to start you at 300 for now and see how that works. And then, of course, we have the injections. Or we could give you, you know, oral steroids. I'm not fond of steroids, y'all. I'm not good with stuff. I'm not good with medication, period. But I really don't want your steroids. He says, well, you understand that the shot is a steroid. I said, yeah, I understand that. So he's like, okay, well, our plan is we'll start you out with the gabapentin, and then we can see if we can schedule you to get those, get the injection. And then if all of that fails, he points to this poster on the wall and says, we can look into, and I forget what the name of the little device was. And I just kind of smiled because I'm saying to myself, that was ultimately what you were trying to get to, right? Your goal is to sell people on this thing you're advertising because you're probably getting a kickback from the company that makes it. I'm not feeling good about any of this. I'm not feeling good about this whole pain management thing, period. I just don't think that I'm gonna have to come up with another plan. If any of you out there listening have had to deal with this and you've gone through some things that actually worked, right? That was not just folks shooting you up or making you take a bunch of medications to keep you groggy and you don't know what's going on in your world, let me know. For those of you who if this is your first time watching one of my videos, please like, subscribe, share, and comment. I want to hear from you. Help me out. What do you guys think the next thing I should do? Talk to you later.